Hello and welcome back to our mental wellbeing series with me, Fatima, and consultant psychiatrist Dr. Mahmood Khan. If you have listened to some of our previous podcasts, then you'll know we talk about lots of different things that are to do with your mental wellbeing, for example, sleeping, breathing and thinking. Today we will be talking about exercise and its importance when we think about mental wellbeing. So, Dr. Khan, how are you?
I'm really well, thank you.
Good. Thank you so much again for being part of our series. And so my first question to you is, what is the link between exercise and, of course, the series name, Wellbeing?
So, as we've talked previously, we've mentioned well-being has lots of different components to it, and all these components are linked together. Previous podcasts, we've talked about breathing, sleeping, thinking, and just like all those things, exercise has a major role to play in both our physical and mental well-being. I'd just like to say, for example, if I was going to think about my risk of having a heart attack, risk. So it's what's the likelihood at some point I'm going to have a heart attack? So when I'm going to think about that, I might be able to think about those things that I have control over and those things that I don't have control over. So things that I don't have control over might be like my family history of heart problems in my family. So if there's a strong family history, then there's going to be a strong genetic risk that I might have a heart attack in the future. And there's not much at this moment in time I can do about that. However, there is lots of things I can still do despite having a strong family history of risk for heart problems. For example, I might choose to not smoke. I might choose to have a healthier diet. I might choose to have a better sleep pattern. All of these things reduce the risk of having heart problems. So I really just want to get across there are things that can increase your risk incrementally and things that can reduce your risk incrementally. And all of these things are within our control. And exercise is one of those things, again, that we have a lot of control over in terms of how we want to go about having better well-being.
And so can I ask just for almost like a very simple definition of what physical activity is?
So physical activity means any movement of your body that uses your muscles and expends energy. One of the great things about physical activity is that there is an endless possibilities of how you might want to keep active, and there's always something that somebody can actually do that suits them.
So could you go into a little bit of detail about what different types of physical activity there are?
So being active, physically active, does not necessarily mean you have to go to a gym or take part in a particular sport. So I suppose the distinction I want to make for our listeners is you can have, for example, daily physical activity or what we might classify as exercise, and the third one is sport. So daily physical activity, what do I mean by that? So this is activity that is just part of our daily life, our daily routine. For example, I parked my car about 5 minutes away from here. So I've walked to get here.
Yeah.
That's part of my daily activity. It might be that I actually do cycling or I walk to work. Alternatively, for example, I work with nurses that do lots of home visits. So they actually walk around quite a lot as part of their job. And daily activity can also include household chores. So when I'm cleaning the house, when I'm hoovering up, all of these things are daily activities. And if you start to think about those as being really important in our way of keeping active, it begins to add up. The second one is around exercise. So this is more purposeful activity carried out to improve our health or fitness.
Yeah.
And there's different kinds of exercise. So there's, for example, aerobic exercise. Fatima, do you know what that is?
From my A-level days, that's like using oxygen, and I don't imagine like a higher heart rate.
Okay, so it's cardiovascular. So what people might term as cardio. cardio exercises. So, for example, when I go on to a cycling machine, okay, I'm using my lungs and my heart really a lot more than I would normally. Jogging, again, is aerobic exercise. And that is very different to strength exercises. Okay, and strength exercises might be things like doing weights.
Okay.
So you're actively kind of working on your muscle groups. Sports. So that's more around structured, perhaps more competitive activities that we can get involved in. So playing football, squash, badminton, cricket. And the nice thing about these activities, again, are you can either do them in a team or you can do them on your own. The key thing is, how can we, and this includes household chores as much as exercise or sports, how can we make these as fun as possible? Because the more fun you make something, the more likelihood is you're going to do it again. You're more motivated to do it again, and you're more likely to actually carry it on.
And so I'd just like to ask about is there any kind of small relationship between Islam and the Quran and what it says about physical activity? Because in our previous podcasts, we always make that link, and I think it's quite interesting.
So the first thing to say is that the Quran was revealed over 1,500 years ago, and people in those times were a lot more physically active, and they didn't have gyms. They didn't need gyms in those days. But nowadays, I think, we live much more sedentary lifestyles, a lot more distractions of watching the TV, being on the iPad. So this idea that you're not moving around as part of your normal daily activity as much as you used to do in the past. The key message is every Muslim has a duty to look after their mind, their body, and their soul. And a good way of then looking at that is some of the essential things that we are all meant to engage in. So the 5 pillars of Islam. What are the 5 pillars, Islam?
You're putting me on the spot. Okay. Fasting, Shahada, Hajj, Zakat, and there's one more.
Prayer.
Prayer. Okay, yeah, of course,
Okay.
prayer.
Excellent. It's always more difficult when you put people under, but it's what we said last time about thoughts, isn't it?
Yeah.
And what goes through our minds. So all of those 5 pillars of Islam rely on a sound mind. Okay. But 3 in particular rely on not just a sound mind, but a sound body as well. So those include the prayer, 5 daily prayers, Hajj, and also fasting. So you're not meant to fast if you're not physically well. Your 5 daily prayers, really, really important. The fact that first thing in the morning when you get up, to actually go to mosque, walk to mosque. The further it is, the better. You get more sawab, you get more blessings. And each act of prayer and all the movements of the prayer, they're almost, I'll talk a little bit about Pilates later, but every movement of prayer actually is a workout for the body. And also the idea that when you go to mosque, it's not just a place of worship. Mosques historically were community centres. It allowed not just your physical well-being, but also socialising, talking about issues, problems that you might have. And it allowed you to actually have a better mindset.
Yeah, of course, yeah.
Okay. And the other pillar of Islam that you mentioned, Fatima, was Hajj. And if you're able to and you can afford it, then doing the Hajj is one of those pillars. The common way of understanding the Hajj in terms of when to do it is you should do it perhaps when you're young. And that is really important because it is a very strenuous couple of weeks that you have to put your body through, never mind actually helping your mental well-being as much as anything. But the idea that there is a lot of physical activity involved in prayer, in Hajj, really, if that's the basis of Islam, it means that we should carry on these kinds of activities, physically keeping the body, rather than kind of, I won't do any physical activity until I do Hajj, and then I'll stop doing physical activity after it. I think there's a real message in there for us. And then when we look at and read the Prophet and Hadith, what we find is that the Prophet ﷺ was a very physically fit person who strongly encouraged physical activity in both men and women. Lots of Hadith about the Prophet really spending a lot of time walking. If there was anything that could be done, walk to it rather than use the horse or a camel or whatever. And also stories of the Prophet ﷺ having races. Okay, with Aisha radiallahu anha. And lastly, this whole thing about the Prophet encouraging people to take up archery, horse riding and wrestling. Okay, so a fair amount written in Islam about the importance of physical activity.
And then, so we've spoken a bit about what physical activity is. What are the benefits and what is the impact of physical activity?
So in short, physical activity can really save your life and gives you better quality of life. So doing regular cardio and strength training reduces the risk of heart disease that I mentioned earlier, but also reduces the risk of diabetes and certain kinds of cancer. It's also essential for healthy bones and joints and maintaining our muscles. And I just want to also mention something about dementia and the risks of dementia. So dementia is cognitive decline when people get older.
Yeah.
And what we know is that improvements in the healthcare system have resulted in increasing life expectancy and therefore a much older population. And alongside this increased life expectancy, there has also been an increased number of people who are being diagnosed with dementia. And one of the main symptoms of dementia is memory loss. And dementia in a lot of cases is a progressive disease that results in people becoming more and more impaired over time. So physical activity has been identified as a protective factor in studies that have examined the risk factors for dementia. So people who have already developed the disease, physical activity can help delay further decline in their functioning. It's also important to note that physical activity seems to reduce the likelihood of experiencing cognitive decline even though you haven't been diagnosed with dementia. The other aspects of the benefits of exercise is you feel less stressed and happier. You'll relate to people that have exercised and they'll often say they feel a little bit high. So it's a natural way of the mind being activated in a way that allows you to feel better. So exercise has a proven way of improving our mood and decreasing anxiety. And studies show that the fitter you are, the better you'll be at handling long-term effects of stress. Research has shown that exercise can be more effective than drugs in treating mild or even moderate depression. And definitely, even if you're having medication for depression, to actually have behavioral activation, to do some exercise can help your improvement as you're getting better. I remember probably going back about 15 years when I had two losses in my family. One was my nephew, who unfortunately passed away when he was about 10 years old. And then my mother-in-law passed away, again, within probably a space of about a month. And I had to have time off from work, as you would need to. But I can remember being at home and feeling quite down. But one thing that I was very aware of was that just sitting doing nothing wasn't going to help me improve. And so I can remember actually kind of saying, every 15 minutes, I'm going to get up and clean this window in the house, okay? And then I'd sit down again because I obviously wasn't motivated to do anything more. Yeah. But every 15 minutes, getting up and cleaning something else, and just that behavioral activation allows you to start feeling a little bit better. Also, exercise not only has a positive impact on our physical health, but it can also increase our self-esteem. Self-esteem is how we feel about ourselves and how we perceive our self-worth. It's a key indicator of our mental well-being and our ability to cope with life stressors. So this relationship between physical activity and self-esteem holds valid throughout all age groups, from children all the way to elderly people.